So you're playing your favorite sport and you clash heads or maybe take a massive hit and you begin not to feel too well. You go to the doctors and after various tests, the tells you have a concussion. And he explains the whole recovery process to you and it's a bit confusing. Rest is important, exercise or physical activity is important. What is it that you have to do? So the point of this video is going to be showing the importance of physical activity or exercise on improving the recovery process and making it go by faster.
So recovery is usually divided into three phases: the acute, subacute, and chronic phases. The acute phase is essentially the same for everybody. Some questions remain over the subacute phase, and the chronic phase is more related to people that have symptoms that last over a longer period of time. And I will now go a little bit more into depth on each of these phases. So the acute phase, as mentioned, this is the same for almost everybody, where you have 24 to 48 hours of rest, which includes physical rest, so no exercise or physical activity, and mental rest, minimal homework assignments and engagement with technology. And also trying to do too much in this period can hurt your recovery and make it longer. Furthermore, resting longer than 2 days has shown to not improve recovery, and in fact, many cases can be detrimental. This is because longer periods of rest, for example 5 days, don't seem to lower the presence of symptoms, as seen in the graph to the right, where usual concussion care was better for the resolution of symptoms instead of 5 days of strict rest. Also, longer periods of rest can lead to deconditioning, physically and cognitively, along with anxiety and psychological complications like depression. The next phase is the subacute phase. This phase is after those first 48 hours of rest. And now it's time to go back to whatever you were doing before. You did your 48 hours of rest, right? Not exactly. Like with any injury, you need to ease into it. And this phase is for that. Slightly increasing the amount and intensity of physical activity that you do, and only working up until the point the symptoms worsen. Typically, this phase involves doing light jogging, or even better, a stationary bike to minimize your head movement and prevent further symptom worsening. So the third and last phase is the chronic phase. This is trying to get you back to your pre-concussive state. So you keep increasing the intensity and increasing the difficulty of the exercises you do. So for example, adding more movements, more stimuli like light, sound, more equipment. If you're using balls, more balls. And you're just trying to get back to how you were. So that was a little bit how physical activity is used in the recovery process. But how does it actually influence the recovery? Well, there have been a few findings. First, physical activity has been found to shorten your recovery time. Second, physical activity can be used as a management tool and prevention tool for persistent symptoms of concussion in people that have symptoms that last over a longer period of time. And now I'll go a little bit more in depth about these findings. So recovery time and exercise. It has been shown that after a concussion, the time to begin physical activity can influence the time required to return to school or sport. Typically, people that start light physical activity 1 to 3 days after the concussion will have most people return to school in about 15 days, and everybody's probably going to return in about 25 days, as seen in the left graph below. Meanwhile, people that begin physical activity 20 days after the concussion can take up to 60 or even more days to return. And that's a big difference for you to get back to your pre-concussive life. Furthermore, a similar result is seen in the return to sport timeline, as seen in the right graph below, where people that started exercise earlier after the injury returned to sport much earlier than those who didn't. So why does exercise have this effect? Well, physical activity, specifically aerobic, like jogging and biking, has been shown to promote mechanisms in the body that help with brain cell remodeling and increasing blood flow to the brain, which is important to have adequate energy supply to help those repairing brain cells, along with proteins that help with symptom resolution and positive neurotransmitters like serotonin that help prevent psychological complications. So the second finding I mentioned is related to persistent symptoms, which is related to the chronic phase of concussion recovery. Persistent symptoms has had multiple definitions, but recently has been defined as concussion symptoms that last more than 14 days for adults and more than 4 weeks for children. Now, it is through the Buffalo Concussion Treadmill Test, or BCTT, that we can help manage and treat these symptoms. But before we hop into the fun stuff, just a little about the BCT protocol. It takes 25 minutes or until the patient cannot perform anymore. So for the first 25 minutes, the patient is on the treadmill at 3.6 miles per hour at 0% grade. And for the last 10 minutes, there's an increase in speed and percent grade, every minute until the end. And then based on the results of the BCTT test, the clinician can determine the extent of a physiological injury, but also exclude other injuries like vestibular-ocular injury or a cervicogenic injury. So if it's a physiological injury, they could experience a headache at rest, dizziness, fatigue, and cannot exercise for the majority of the test. If it's a vestibular-ocular injury, this is where symptoms will be related to injuries in the inner ear or the visual system, so they could experience dizziness, blurred vision, trouble focusing, but will be able to exercise for the majority of the test. And then a cervicogenic injury will have symptoms related to the neck or the cervical spine, so they could experience a mild headache at the back of the head during exercise, neck pain or stiffness, and low neck mobility. But again, will be able to perform the test for the majority of the time. Additionally, a clinician, based on these results, will be able to create an individualized submaximal exercise program that will help in addition to other treatments and therapy to solve persistent symptoms. And one last point. Some research has shown that exercise can improve performance in motor and cognitive tasks after a concussion, like for example bringing your finger to your nose. This is important because many people with concussions experience deficits in these types of tasks because of the trauma to the brain that they experience. However, more research is required to clearly show the effects exercise has and to also determine which intensity would be best to promote better performance, which is seen in the graph below, where moderate exercise in white, like a slow jog or mowing the lawn, has been shown to improve performance. But because of everybody's individual differences, for some it may be too easy to jog and mow the lawn, for some it may be too hard, which is why it's important to find a relative intensity to apply to everyone and allow everyone to benefit. This is why I decided not to include this point in my main findings, but it is showing promise, and maybe you will be inspired to look more in depth into this topic. That is all my time. I hope you better understand the importance of exercise in the recovery of concussion and getting you back to your pre-concussive state as soon as possible. Thanks for listening.